But good morning. My name is Dr. Doug Wingate. I'm an integrative neurorehabilitation specialist. And today we're going to talk about neurogen brain balancing, what that is as a passive form of neurofeedback, and how it can be helpful and applied for headaches and migraines. So before we get into sort of the meat of the presentation, just a quick disclaimer that everything we'll be talking about today is intended for educational purposes, and it's not meant to be any sort of prescription or recommendation for or diagnosis of any particular disorder, and to certainly talk with your medical professional about what might be a good fit for you. So firstly, let's talk a little bit about migraine. It's a major problem throughout the world. A lot of people suffer from migraine, which makes it a really relevant conversation to have. Migraine is considered one of the most common and one of the most debilitating or disabling neurological conditions in the world. It's estimated that over 1.1 billion people are affected by migraine to varying degrees. It's consistently ranked as one of the second most disabling conditions amongst all diseases, and considering the leading cause of disability in people under the age of 50. And that's according to the Global Burden of Disease Study. Um, Mental health and depression is considered the number one, and migraine not far behind that. So many people being affected by migraine, and that's beyond just headache. Um, we won't get too much into the difference, but just know that is specifically focused on migraine itself. Biological women are considered about 3 times more likely to be affected by migraine. This is because of neurohormonal factors that can come into play. Chronic migraine can significantly reduce physical function, concentration, sleep quality, emotional stability, and capacity to maintain work or social responsibilities. Many report feeling trapped in a cycle of pain, medication use, and functional impairment that dramatically reduces overall quality of life. So, of course, um, migraine being a very severe debilitating head pain that often comes with a variety of other symptoms, including light sensitivity, sound sensitivity. You can get severe nausea, dizziness, vertigo, a lot of um, other symptoms that come along with that. And often it was a situation where it's so overwhelming. Often people want to just shut out as much external stimuli as possible. Lie on the floor in a dark room and just not have any sort of sensory stimuli, because anything that is coming in, any sort of senses, is going to be even more overwhelming or just make the situation worse. So it can certainly be quite debilitating. So we're going to talk about neurogen brain balancing. What that is, that's something that I offer in my clinic. It's a passive form of neurofeedback. So the way that they describe it is a novel, passive, non-invasive neurobiomodulation modality for brain health. It has an innovative, non-invasive neurobiomodulation technology designed in order to optimize brainwave function and restore neurological balance. And we'll talk about some of the how that works and how that comes into play. Unlike conventional neurofeedback, which requires active client participation, Neurogen brain balancing delivers therapeutic benefits passively through low intensity pulse transcranial electrical signaling, or lip tests, and EEG guided protocols. So with neurofeedback, conventional neurofeedback, what you have is you have a number of leads that are attached to the scalp. It takes a reading of what the brain is doing, so you're able to see the brain waves, how your brain is activating, and the activity within different areas of the brain in real time. And then with conventional neurofeedback, you're interacting with some sort of interface. So a computer screen, or you're responding to an audio tone or visual cues and things like that. And you're sort of retraining and working out your brain in response to those. Neurogen works in a passive way where it basically does the work for you. So it takes that reading, we're able to see in real time what the brain is doing, see the different brain waves. So we can see alpha, beta, theta, delta waves, how those are interacting. We're also able to see and differentiate low beta and high beta waves, which come into play in different imbalances or incoherencies that can be going on in the brain, especially relevant to migraine. So it takes that information and it's in real time adaptive, analyzing that information and sending back an offset frequency signal. So it determines where there's incoherencies, where the brain is not communicating as effectively as it should, and then offsets a frequency relative to that brain state in real time, sends that back and gently guides the brain back into what we would consider coherence or better communication, or rebalancing. So it's sometimes described as giving your brain a sort of a tune-up. Rather than having to do any sort of interactive component, everything is done through the system, and myself as the practitioner engaging how much time, what sort of waveform we need to be using, and what's going to be most appropriate. So it's very easy for the person receiving the therapy. You come in, have a seat in the chair, give me an update, and um, pretty much do everything else for you, which makes it very accessible for a lot of people, which we'll talk about in a little bit. A lot of what I work with clinically is also individuals who have a history of neurotrauma. So that can be concussion, traumatic brain injury, stroke, and things like that. And another real advantage of that passive component is that sometimes the engagement with a screen or an interface can be overwhelming or overly fatiguing. And that does come into play with migraine, as we'll see as well. But there is a term that's in there, neurobiomodulation. And what does that really mean? So neuro, of course, means that it pertains or has to do with the nervous system or the brain. So we're taking direct readings of the brain, and then we're influencing the nervous system. We're sending information to the brain itself and getting it to uh, function more properly. And I didn't mention, but the when it says low level frequency that's used, it's a very, very low intensity. It's one less than 1/1000th of the amount of electricity that's coming off of your cell phone in your pocket. So you don't actually feel anything during the session itself either. Some people who are really aware of sensory information on their skin or their scalp might have an awareness, so they might feel a small buzzy sensation. But most people don't feel anything at all during the interact during the intervention. So nervous system, brain, biological, or having to do with the body. It can be applied to different areas of the body as well. Sending that signal can be anti-inflammatory. We've done situations where we've used the system over areas like the back or the shoulder for frozen shoulder, or different areas where there might be chronic pain conditions. Knee is another really common one. And modulation means the ability to introduce change. So it modulates or creates change in that area. So we're changing how the brain is interacting and how the brain is communicating. So neurobiomodulation is an advancing therapeutic domain that employs low-intensity electrical signaling or electromagnetic signals in order to regulate dysfunctional brain activity and promote restoration of neural circuitry. So when people are having a migraine or have a tendency toward migraine or migraine patterns, we're looking to um, either sort of reset that pattern or get the brain to step out of that pattern by sending a frequency that um, again guides the brain into more coherence, better communication, moving out inflammation, and getting that pattern to stop. So I sort of touched on this in terms of accessibility to therapy. One of the huge advantages to Neurogen, brain balancing, as opposed to conventional neurofeedback, is its accessibility for a wide range of individuals who might not be able to really interact with conventional neurofeedback for a variety of reasons. So, for instance, age comes into play. I work with very young individuals, as young as two, who have had neurotrauma, brain trauma, and they wouldn't be able to consciously interact with conventional neurofeedback, but were able to do neurogen brain balancing, and they would respond quite well. And then again, those who have significant neurotrauma where screens and interfaces might be overwhelming, too fatiguing, too engaging, or debilitating in themselves. So the passive nature of Neurogen makes it particularly suitable for those who might struggle with therapies or modalities that require active participation, whether or not that be psychotherapy, so an ability to really communicate or work through their thoughts. I've worked with a lot of people who have brain fog, very common symptom. Um, or traditional or conventional neurofeedback, as I mentioned, due to cognitive or neurosystem overload. So it just being too much for the system at that particular time. And of course, the goal would be to sort of expand what we refer to as the window of tolerance so that people have greater ability to engage with things like that when appropriate or when necessary. But often when people are coming in to see me initially, the nervous system can be so activated or so close to being overloaded that putting much demand on the nervous system, it just pushes it over that threshold. So we don't want to do that, obviously. Situations where there's trauma or attentional impairments. The distinction here is especially important in populations with neurological burden, including those who suffer from migraines, who might be unable to sustain attention-based training due to sensory overload, pain, or fatigue. So, if the nervous system, if you are in a significant amount of pain, if you were just overloaded by a sensation, it's very nice not to have to do anything. Um, the reported absence of long-term adverse effects are also allows for accessibility. So neurogen brain balancing has been shown to have very few negative effects. Every once in a while, people will report some mild nausea or some dizziness following the session as the brain is sort of integrating in the information. And so I often tell people, if you need to take a few minutes, it usually passes in 10, 15 minutes or so, or somebody might feel a slight disorientation. The world just feels kind of wobbly for a few minutes. Um, and just have a seat, have some water, and it usually passes pretty quickly. It's just the brain, again, integrating that information. Beyond that, there really hasn't been um, negative effects that have been reported. Despite more than 30,000 recorded sessions with Neurogen between 2019 and 2025. So the minimum effect profile positions it as a compelling alternative to pharmaceuticals and other invasive interventions that might be used for different situations, different conditions. So next we'll talk about how some of all of this works, the different mechanisms of action in terms of what Neurogen is actually doing. Firstly, one of the things that it does is the disruption of maladaptive oscillatory patterns. So what that means is that it's able to break our brain out of these negative patterns or unhealthy patterns that it can really get stuck into. So able to guide the brain out of those self-perpetuating patterns that show up. Migraine itself is increasingly understood as a disorder of cortical hyperexcitability and abnormal thalamocortical rhythm. So what that means is thalamocortical, two different areas of the brain, the thalamus and the cortex of the brain. So most of our brain, especially the frontal region, and the thalamus is an area of the brain that's deeper within the brain structure and is a major relay station for incoming sensory information. So any sensory information from the outside world through our skin and through our body, and also information from inside of our body as well. All of that gets shunted to the thalamus, and then the thalamus processes that to some degree and kind of determines where to send that information off to. So that communication between the sensory relay station, the thalamus, and the rest of our brain gets thrown off or out of rhythm. And with that comes a hyperexcitability, which means that the brain is more activated and more excitable, so it's more reactive or sort of hypervigilant to incoming information. So EEG studies have demonstrated increased gamma and high beta activity. These are brain waves frequencies that our brain works at, and that there is this association between increased gamma, increased high beta activity between migraines, showing a heightened neuronal firing and increased sensitivity. So this is that hyperexcitability. The nervous system is more easily influenced and sort of more on edge. It's more primed to fire a lot more fast and to respond. So that hyper sort of underlying nervous system hypervigilance. So through algorithm guided microcurrent delivery, neurogen brain balancing interrupts entrenched maladaptive patterns, unhealthy patterns that we get stuck in, and pushes hyperactive networks toward a normative state. So it's taking those hyperexcited networks, brain networks, and guiding them into self-regulation or re-regulation. Another way that neurogen works and is helpful is neuroplasticity. Neuroplasticity is the brain and the nervous system's ability to create change and to rewire itself in a sense, create new neural connections by reorganizing its structure, functions, and connections. So it's how adaptable our nervous system is and how available it is to create change or to break out of these patterns and create new patterns. By promoting conditions favorable to neuroplastic rearrangement, Neurogen can support healthier connectivity throughout the brain networks, especially the networks that are involved in pain processing. These include large-scale brain networks known as the default mode network, which has a lot to do with our sense of self and operations that we're doing sort of more on autopilot or what the brain defaults to most of the time when it's not actively engaged in processing new novel material. The Salence network, which has a lot to do with actually regulation of the default mode network and this dynamic that happens between that default mode network and what's known as the central executive network. When one is activated, the other is less activated or less active, and that salience network acts to allow that shift between those brain networks. And then descending pain inhibitory systems as well. So descending means the tracks that go from our brain out to the periphery, out to the rest of our body, that help inhibit pain, help reduce the pain signaling. So it influences all of those brain networks. Another mechanism is anti-neuroinflammation. So, neuroinflammation is a huge issue with migraine and a number of other neurological conditions as well, especially chronic pain conditions. Uh, Relative to migraine, neuroinflammation plays a critical role in chronic migraines through cytokine release, glial activation, and trigeminovascular sensitization. So, what that means is the relationship between the trigeminal nerve, which is a cranial nerve that has three branches across the face. There's one that comes along the bottom of the jawline, one along the cheekbone, and the upper branch comes across our forehead and the top of the eye. So there's a condition called trigeminal neuralgia, which can be an excruciating pain condition along that trigeminal nerve. So really intense facial pain, which has overlap with where a lot of people experience migraines. And there's a relationship between the trigeminal nerve. It's more than just those three branches along the face, but it actually goes and deeply connects into our brainstem and areas of the neck to do pain processing on a much wider scope. So when the trigeminal vascular sensitization is happening, it's increasing the possibility of increased pain pretty much anywhere, but certainly in the head area because that trigeminal nerve is right over the face and the scalp. The trigeminal nerve is also when I'm teaching cranial nerves, I really emphasize just how much influence this has well beyond just the three branches that are shown when you take a look at the diagram. But it really has a systemic influence on pain processing. And so sensitization of that means that that threshold for pain is drastically reduced. So pain levels can really skyrocket, or you can be more prone to chronic pain conditions. So Neurogen along these lines can reduce central sensitization, which is a huge issue for a lot of chronic pain conditions, a hallmark of chronic migraine as well, and contribute to improvements in photophobia, which is light sensitivity, headache intensity, and pain persistence. And the picture here is before and after EEGs, qualitative EEGs that were done on actually the founder of Neurogen brain balancing prior to treatment and afterward. And so the prior to is the picture on the left. The red areas are areas where there's a fair amount of inflammation and overactivation or oversensitization. And then after treatment, there was a drastic reduction in that. And that's what you're seeing in the diagram on the right there. So this has been substantiated through qualitative EEG that it can influence and reduce neuroinflammation. Another big mechanism with neurogen is regulation of the autonomic nervous system. Autonomic nervous system is sort of in charge of everything that our body does automatically. So without us consciously thinking about doing it, things like breathing and our heart rate and things like that. Migraine attacks are closely associated with a dysregulated autonomic activity or autonomic nervous system. This is through what's referred to as sympathetic overactivation or an overactive fight or flight response. Anytime that we're faced with stress or a life-threatening situation, or what our body or mind perceives as a life-threatening situation or stressor, it activates the sympathetic nervous system. It activates that fight or flight response. And with things like ongoing trauma, PTSD type things, you can have this overactivation, or this is where hypervigilance comes in, where our body kind of gets stuck in a fight or flight, and it has a really difficult time down regulating from that. And with that, it also impairs parasympathetic tone. So parasympathetic is sort of the counterbalance to the sympathetic nervous system. Rather than fight or flight, it transitions the body into focusing more on resting and digesting. And so that's impaired when there's an overactive sympathetic nervous system or too much fight or flight going on. And so this throws off the entire autonomic nervous system by influencing the limbic and the prefrontal circuits in the brain. The limbic system is your emotional center. The prefrontal is the front of your lobe that has a lot to do with the higher cognitive processing, making judgments, decision making, working memory, a lot of what's referred to as executive function, or when it's not working properly, executive dysfunction. So the prefrontal circuits in the limbic system are their involvement in the autonomic control. Neuromodulation is able to shift the system toward a sympathetic dominance, which means moving the body out of fight or flight into the rest and digest, reducing stress, reactivity, and enhancing resilience. Now, many recipients of Neurogen report improvements in sleep, anxiety, and emotional regulation, symptoms linked to autonomic function and migraine thresholds. When I'm teaching at length about migraines, I really emphasize how much influence the autonomic nervous system and cases of dysautonomia, where there's dysregulation in the autonomic nervous system, more and more we're understanding that that is a key component when it comes to migraine, is the dysregulation in the autonomic nervous system. And treatment approaches really need to be geared toward working with that autonomic nervous system in order to get long-standing relief and long-standing therapeutic effect. Another mechanism is restoration of network homeostasis. So I mentioned brain networks before. The brain doesn't really work as isolated regions. So while there is an auditory section of the brain, there's also an auditory network, for example. And so multiple areas of the brain that communicate together and process in this case, auditory information, sort of together and communicate with one another. And there are a bunch of different networks that we understand to be in play. There's the language network, there's the visual network, and then some of the ones that I mentioned before, like the default mode network and the salience network. So chronic migraines involve large-scale brain network dysregulation rather than a localized dysfunction, which means there's not one area of the brain, one little region that's affected, but migraines affect large-scale networks of a number of different areas of the brain simultaneously. So by working at the network level through Neurogen, rather than attempting to just suppress symptoms and get the pain levels down, which of course we want to do and are able to do, Neurogen can also help restore baseline homeostasis in cortical, limbic, and autonomic circuits. And so it's guiding the brain and these brain networks back into regulation at a foundational level so that it's doing much uh, more than just relieving symptoms, but instead getting those networks to function properly so that they're not leading to symptoms in the first place. So it's working as a preventative as well, or a regulatory therapy working to break out of those migraine patterns. So to kind of go over those as a whole briefly, migraine is uniquely responsive to neuromodulation because of some core disturbances that are in play. Hyperexcitability, central sensitization, which again means that it's a brain-based overall sensitization or hypersensitivity of the nervous system, where pain as a whole can be amplified and increased. Autonomic imbalance and impaired pain inhibition. All of these map onto domains that are influenced by low intensity electrical signaling. Neurogen's passive EEG guided adaptive modulation directly influences these pathways, offering a biologically plausible mechanism for reducing frequency, intensity, and functional impairment. So again, this real-time adaptable quality where the therapy is responding to the brain, and at the same time, the brain is responding to the therapy, and then the therapy is continuing to respond to that response. It's constantly updating, and this is a unique aspect that really lends itself again to working foundationally at re-regulating things. So I want to talk about some of the limitations of some of the other current migraine medications that are out there. Despite widespread use, standard pharmacological treatments, things like triptans, CGRP inhibitors, anti-epileptics, SSRIs, selective serotonin reuptake inhibitors, or SNRIs, selective serotonin and norepinephrine reuptake inhibitors. Those are a lot of your classical antidepressants and beta blockers. Those medications are often inadequate for chronic migraine sufferers. So up to 40% of migraine patients discontinue preventative medications due to inefficacy or intolerable side effects. Reports that preventative medications provide only about a 30 to 50% reduction in monthly headache days for many. And medication overuse itself is a major clinical problem, with medication overuse headache occurring in up to 1/3 of chronic migraine patients. This is something that really doesn't get discussed nearly as much as it should, because for a lot of people with chronic pain conditions, they're often taking pain medications pretty regularly. And what you end up with is, if you're taking pain medications so many days out of the month, and it's not a lot of days, it's maybe 1/3 of the month, then it starts creating a situation where the body is actually creating headaches or creating pain due to over medication. And so the frequency of the medication itself is then perpetuating pain and headaches. And that becomes a major problem, especially if that's not being even considered. If somebody is taking um, any of those medications mentioned above, or over-the-counter NSAID pain medications on a regular basis, or anything near a daily basis, um, likely going to have at least a risk of medication overuse headache coming into play. So that needs to be considered. Uh, Many medications also require weeks to months to take effect, yet produce sedation, cognitive fogginess, depression, weight gain, or cardiovascular risks. While Neurogen can be calming, it doesn't tend to have a sedating quality where people are impaired in any way or lose any sort of functionality. It's just that the body has the opportunity to shift into that rest and digest. And a lot of the time, especially if we've been locked in fight or flight for a really long time, if the nervous system has been activated for a really long time, when it finally gets the opportunity to move out of that and relax, it may want to take that opportunity. So some people will feel very relaxed, want to take a nap, or go to bed very early the day of the session, right after the session or so. In terms of cognitive fogginess, depression, weight gain, cardiovascular risks, Neurogen can actually help prevent or work counter to those things. So I work with a lot of people who have cognitive fogginess when they come in, brain fog, and find that Neurogen helps relieve that. They'll report that things feel more clear, they're thinking with more clarity. And so you don't get any of those sorts of side effects with Neurogen that you do with the medication, and they can actually work to improve the states of those things. Some of the limitations of conventional neurofeedback, especially around migraine, is that often conventional neurofeedback requires quite a few sessions. So often you're looking at 30 to 40 sessions, commonly being required before any sort of meaningful change is seen. This is not the case with Neurogen. Instead of oh, the participant working out the brain and resetting the patterns, Neurogen is again reading the brain and guiding in real time your brain into better regulation. So a lot of people will notice effect within the first session or two to some degree. And if it's a long-standing chronic condition or state, it may take a number of sessions after that. My usual recommendation is to start with 5 to 6 sessions and see if some significant change can be made, and then reevaluate whether or not more sessions are necessary. Some people, as I sort of said, respond very well and very quickly to just the first session or two. First session or two are really focused on re-regulating the entire brain. And then once that's been done, we can continue with that if it's appropriate, or we can kind of custom tailor the session and the treatment to the areas of the scalp or the areas of the brain that really need the re-regulation. Many clinical protocols with conventional neurofeedback require 2 to 3 sessions per week for 3 to 5 months, which is both costly and difficult to maintain, especially when you're dealing with chronic migraine, making appointments on that regular of a basis for that long, or chronic pain conditions. It's very difficult in the hopes that you will be seeing results eventually. With conventional neurofeedback, the results are highly variable and depend on participant effort, attention, and learning ability, precisely the different domains that migraines disrupt or affect. So migraines can affect cognition, it can affect focus and visual tolerance, which makes it difficult. So if you already have visual tolerance issues and say lights are a trigger or something that can bring on migraines, staring at a computer screen and moving your eyes around to engage with that might be problematic. It might actually bring on a migraine. And so that doesn't come into play with Neurogen, one of the advantages there. And also with conventional neurofeedback, studies show mixed outcomes with small effect sizes and high dropout rates. A lot of that has to do with how long that protocol is and how many sessions are involved. Um, Research with Neurogen brain balancing for migraine. There has been a pilot study done. The pilot study was done with 5 sessions over the period of 3 weeks. So people were coming in twice a week, up to their 5 sessions. And this is a forthcoming study. So the study has been done. The results have been calculated. But until the paper is formally released publicly, I can't give you those statistics. even though I'm privy to them. I'm co-authoring on this paper. So I'm aware of the results, and they were very promising. Um, and hoping to lead into an even larger study, seeing how effective it was just with 5 sessions over a brief period of time. While I can't share the statistics right now, again, the paper will be out after not too long. It's February 2026 right now, and I'd say by March or April it should be publicly available. But I can read some of the reports, some of the feedback that was given by some of the participants, and yeah, we can go over some of those. So the first quote is before the sessions, I was even afraid to fall asleep and would often wake up with a severe migraine. Since the last session, I haven't had a migraine probably for the longest period in the last 3 years. And something to keep in mind here is that the participants across the board were chronic migraine sufferers, most of whom had been experiencing migraines frequently, at least several times a month, if not several times a week, for years, if not decades. I think in most cases we were looking at decades, and had tried a number of other therapies. So it would be considered treatment resistant persistent migraine patterns. Most of these people have tried a lot of other things and haven't really gotten relief. And this is some of the feedback that they got again after 5 sessions or within the study. So the next quote is, although it hasn't completely gotten rid of my migraines and headaches, I have noticed a huge difference in the intensity and duration of them. I feel like I'm able to get rid of them way quicker, which is such a relief. I will continue the treatments. So here we see 5 sessions, especially with chronic patterns, may not quite be enough, but seeing progress and seeing that ongoing treatment beyond the 5 sessions might be really helpful for that individual and actually breaking out of that pattern and reducing the frequency to an even greater degree. The next quote, I've not had a migraine since the treatment started. They came in for a session and hadn't had a migraine since then when the feedback was provided, and we've since done follow up with them a couple months after the study finished up. And some of these individuals have continued to not have a single migraine since then. Not everybody, um, but the multiple instances of that. The next quote, headache and pain free today, feel more open-minded with every session, sleeping much deeper, wake up feeling rested. My memory is better than before. Next quote, before I began this treatment, I had a migraine pretty much every other day, at least 5 days out of the week. By the second visit, I had one migraine, which was very weird. I felt amazing. On my third visit, I walked in with a migraine, really doubtful it would help me, but it worked. I went in feeling my worst, thinking I was going into the ER instead, but I gave it a shot and I don't regret it one bit. I was pain-free after the appointment and got so much done in the day I usually wouldn't be able to, especially without taking medication. And the last one down here, I used to experience 5 to 9 migraines lasting 4+ hours each, but now I have only had one that lasted less than 2 hours. After each session, I noticed improvements in my sleep, focus, and overall relaxation. I also feel that this treatment has helped reduce some of my anxiety. Additionally, I can now be around common triggers like strong smells and weather changes without immediately experiencing a migraine, which is a great indicator of the nervous system re-regulating itself on its own. So again, working toward a pattern where therapy treatment isn't needed, but rather working at the underlying response of the nervous system so that there's a greater what we consider a window of tolerance where it's not nearly as reactive to what have historically been triggers. In addition to this, um, one of the authors in this study while working on the write-up in the paper, um, had a migraine, experienced an acute migraine, and had to push off some of the work. because of the migraine, wasn't able to work, understandably so. Reached out to one of the Neurogen practitioners down in San Diego, went in for a treatment, and got significant relief from the migraine and was able to get back on track and work on the paper. So it was kind of uh, it's not really a funny thing to have a migraine or a painful condition, obviously, but a little bit of irony there where we had somebody that was involved in the study, not as a participant, but as a researcher, get a migraine while working on the research project for migraine, get the intervention that was being studied, and get relief from that migraine and the pain relief. Um, and being able to resume work on the research paper. So just an instance that was unexpected but came into play and also just further demonstrated how effective it was for them as well to be able to do that. So that's what I've got about migraine. If you have more questions, feel free to reach out to me. I'll give you my website at the end here. These are a couple other arenas where Neurogen can be helpful. Some of these I've done other talks about. And if you want more information, again, my website, but with neurodivergent overstimulation, um, Neurogen can be very helpful. So with people or kids with ADD or ADHD or who are on the autism spectrum, when dysregulation happens, Neurogen can be very supportive in re-regulating the nervous system and helping break out of that pattern of overactivation or excuse me, overstimulation. Addiction support, emotional dysregulation like anger or anxiety, it can help calm that limbic system and that communication between the limbic system and the frontal lobe, which has a lot to do with regulating emotions. So it can be very helpful there. Also, by regulating the nervous system, it can be helpful in improving academic performance. It gets the nerves or the neurons firing more efficiently, gets the brain communicating more efficiently as well. So can be helpful in that regard and also with athletic performance because if you're improving the brain, the functionality of the brain, that improves the signals and the functionality of the body as well. So Neurogen's been applied to elite and professional athletes and has been shown to be very helpful for athletic performance as well. Chronic fatigue, concussions, depression, fibromyalgia, executive function, focus and brain fog, which I mentioned a little bit before, insomnia. A lot of people notice improvement with sleep, and if it's an ongoing chronic insomnia, breaking out of those patterns by helping re-regulate uh, those natural rhythms that our brain is supposed to be functioning in, and re-regulating the brain wave frequencies that can get thrown off when with sleep problems. Memory, OCD, PTSD, traumatic brain injury, stress, stroke, Tourette's, and movement disorders. So that's not listed on here, but we have protocols for movement disorders like Parkinson's disease and things like that as well, multiple sclerosis, etc. So that is what I've got for you. Thank you. If you want more information, my website is acuneuromodulation.com. It has more information about Neurogen and my offerings there, as well as everything else that I do in my clinic in my integrative neurorehabilitation work. Specifically about Neurogen, if you want more information, neurogenbb.com. There's the research studies, there's testimonials, there's resources and more information there. And for U.S. military veterans, there's a nonprofit that offers free Neurogen sessions, up to free Neurogen sessions for U.S. military veterans. And in order to access that, you can go to the website for that nonprofit, which is www.bb4vets.org. And it'll have the information and everything that you need to do in order to get set up with that, which is a fantastic, amazing resource. 4 sessions can be incredibly helpful. And so if you're somebody who qualifies for that, fantastic resource. So thank you very much. I appreciate your time, and I'll go ahead and open up for questions. And if we don't have any, have a great rest of your weekend. Take care.